Go.
Jaco is coming. Jaco is coming. Hi, I'm Lisa Campbell, a BSN student at University of Southern Mississippi. Today I'm talking about the Joint Commission. This on the screen you see is the golden seal that a facility would receive if they were accredited by the Joint Commission. Many nurses know when JCO or the JC will be arriving, or maybe not, because most of the time they are unannounced. The surveys are usually unannounced except for the initial survey. So what makes all who work for healthcare facilities scramble at certain times of the year to please this type of entity? If a hospital or facility wants to maintain a high quality rating and be known to provide efficient care, the organization will follow the guidelines and standards put in place by the Joint Commission. The Joint Commission is an independent, not-for-profit organization. It accredits and certifies more than 20,500 healthcare organizations and programs in the United States. The Joint Commission accreditation and certification is recognized nationwide as a symbol of quality that reflects an organization's commitment to meeting certain performance standards. Why does the Joint Commission exist? This is the mission statement and the vision statement. And if you read these, you should note the key words such as continuously, collaboration, inspiring, excel, highest, all, always, and quality. These are listed at the bottom of the slide. The mission and the vision statement in itself tells what the Joint Commission is here for. And these words are important, positive words that they follow through with throughout all of their surveys. All powerful and positive, the Joint Commission is here to make the facilities be the best that they can be. Here's a little history about the Joint Commission. I will not read all of this slide, but starting in 1910, Ernest Codman was a doctor who proposed the end result system of hospital standardization. From then on, there were many standards and changes throughout history as they are listed in this slide. I found it interesting to read about the Social Security Act and the Department of Health and Human Services involving Joint Commission and considering hospitals and facilities to be designated as able to receive Medicare and Medicaid funding just by being Joint Commission certified. But eventually, as the history would tell us, there did require further verification processes. In 1987 to 1989, I'll go back to that slide, the name changed to the Joint Commission in Healthcare Organization, or JCAHO. And their primary emphasis was on the organizational performance as a whole. In 2007, this entity became known as the Joint Commission, or the JC, which some of us may call it. There were many leadership, policy, and standard changes and additions, as can be read on the Joint Commission website in the history section. There is information there for a century. So how does this process work? When Joint Commission come in, the surveyors do on-site assessments. They use techniques such as the tracer methodology, which have a couple of different ways they do it. It could be individual case assessments going from the beginning to the end of a certain patient's case, or it can be a system assessment such as data management or medication management. Benefits of being accredited by the Joint Commission.
Go, please.
After the survey process, where they use different techniques, a summary is provided to each organization where it will be discussed during the exit interview. And there are also post-survey activities, that, let me get to the right slide, excuse me. The central office will review the assessment and the survey, and the Executive Vice President for Accreditation and Certification Operations will also review it and make recommendations that are sent to the Joint Commission Accreditation Committee for a final decision. The final results will be direct or indirect impact standards must be completed within a set time frame to show evidence of standards compliance. Once the last submitted evidence of standard compliance is received, then the decision will be made. They do have time limits on getting these in. So what are some of the benefits of being accredited by the Joint Commission? Quality improvement efforts are maintained by organizations when they are guided by surveyors and standards of the Joint Commission. Most healthcare professionals seek employment in a facility that is accredited by the Joint Commission. And the Joint Commission provides a framework for organization, structure, and management. And here lists some more of the benefits that an organization could have if they are accredited. Some of the standards of care that we are speaking about would be, first of all, I have to say, you must set aside all that you have learned in nursing school, because when you are employed in a facility, there is a whole new learning process. And basically, it is the standards of care of the Joint Commission in order to maintain the hospital's certification and accreditation. Thankfully, most facilities will have memos, manuals, emails, signs around every corner, possibly in the break room, the bathroom, the hallways, to let us know what the new standards are and what we should be upholding as healthcare workers. But the basis of an objective evaluation process that can help healthcare organizations measure, assess, and improve performance are the standards of care. Some examples of standards for hospitals would be emergency management, human resources, infection prevention and control, and these are listed down here at the bottom, information management, leadership, life safety, medication management, national patient safety goals, provision of care and treatment and services, record of care, treatment and services, transplant safety, and waived testing. And some of these have been in the works for many years, and some of them have just come about within the past few years. The Joint Commission sets these standards that are drilled into staff's minds. They affect anyone from administrators to environmental care workers.
Video you should have did that. Go.
In 1987, the Joint Commission announced its agenda for change, which outlined a series of major steps designed to modernize the accreditation process. And here lists the core measures and how they came about, which measures the performance of the organization. Some of the ways that they're measured are through data analysis, priority focus process, ORIX, performance measure reports, strategic surveillance system, and quality checks. Quality checks allow the consumers to look up what the organization is performing at on a national level and how they have avoided, say, medical accidents. They were established in 2004. Okay, healthcare workers might be familiar with the National Patient Safety Goals and relating them to most of the Joint Commission requirements. Some of the National Patient Safety Goals are accuracy of patient identification, which would include having 2 identifiers while giving medication. Each facility might have their own requirement. Communication improvements such as better shift report. Medication safety has always been one of the forerunners, and that would include like labeling medication off the sterile field, etc. The Joint Commission established these National Patient Safety Goals in 2002 to help accredited organizations address specific areas of concern in regard to patient safety. They are advised by advisory groups, which include nurses, doctors, pharmacists, and other healthcare workers. Some of the goals are, which we discussed, the purpose of the National Patient Safety Goal is to improve patient safety. The goals focus on problems in healthcare safety and how to solve them. Early in my career, which began in 1998, I first learned about the look-alike, sound-alike drug list, and soon after we heard about the abbreviation precautions. These standards were again put forth by the Joint Commission to improve patient safety. The Joint Commission determines the highest priority patient safety issues and how best to address them. The goals are program specific. In 2001, nursing was at risk for a crisis due to anticipation of a shortage. The Joint Commission's accreditation process sought to help organizations identify and resolve problems and to inspire them to improve the safety and quality of care and services provided. They measure the standards of care, performance, safety goals, and benefits organizations. Stop. That's the damn. Okay. Nursing, the Joint Commission, and the future of healthcare. In 2001, a nursing shortage was predicted, and a crisis was at hand when they anticipated a short staff. In 2001, a nursing shortage was predicted, and a crisis in healthcare was anticipated. The Joint Commission put forth an initiative to avoid the crisis by developing recommendations that would address staffing, retention of nurses, reduction of paperwork, and safer environments. And then by 2008, there was a new Crossroads initiative where they produced guided principles to the future in healthcare. Nurses throughout these evolving years felt the impact of the changes being made and the enhancement of quality improvement measures. There were economic implications after 2008, such as improving efficiency and reducing cost. Improvements in technology, such as adoption of integrated labor-saving health information technology. Patient-centered care became important, such as making patient-centered values a priority, improving patient safety and patient and staff satisfaction, and eliminating disparities in the quality of care. Staffing, as always, has been important, and this included expanding professional education and training to accommodate a growing demand. support and development, skills and knowledge in a complex environment. And then the physical environment, where safety, infection control, emergency preparedness, and things like going green became popular. The Joint Commission strongly believes that nurses play a pivotal role in the delivery of high-quality, high-reliability health care. Nursing's commitment to improving quality, promoting safety, and reducing patient harm is at the heart of the profession. Some of the recent issues that some nurses and regulatory agencies have been involved in, such as the Joint Commission, are Ebola preparedness, emergency management, pain management, and patient safety, which is usually the forefront of all healthcare initiatives. But in summary, the Joint Commission's accreditation process seeks to help organizations and resolve problems, and to inspire them to improve the safety and quality of care and services provided. The Joint Commission measured standards of care, performance, safety, goals, and benefits organizations by providing a framework. A survey is designed to be individualized to each facility or type of care. The decision process focuses on how critical an issue is to care or safety, and the compliance with standards as determined by the Joint Commission. And there are continuing intra-cycle monitoring processes that help the organizations with their continuous standard compliance efforts. The Joint Commission also strongly believes that nurses play a pivotal role in the delivery of high-quality, high-reliability health care. And the final statement, nursing has gone through many changes throughout history, but safety will always remain a priority. Thank you.